Hey guys, it's Dr. Minardi here bringing you all things STEM. From my journey to yours, we are on an adventure together. Today, we are joined by a wonderful individual who is trying to redefine STEM for a specific profession, which he will speak more about. Please welcome to the stage, Jason. Hey, Jason, how's it going?
Hi, great to be here. Thanks so much for the opportunity.
Of course, we are just so excited for this conversation, and royal we, obviously. So, Jason Garbarino is an experienced nurse educator, clinician, and leader whose 16-year career in nursing spans across various specialty areas. Jason remains clinically active within primary care nursing, overseeing patient annual wellness visits while teaching undergraduate and graduate nursing students. He taught nursing full-time for 11 years as a clinical associate professor at the University of Vermont, or UVM. He served as the vice chair and director of the undergraduate nursing program. And in 2022, he was the recipient of the UVM Krebs Maurice Excellence in Teaching Award for his innovation, creativity, and community building endeavors. Throughout his career, Jason has demonstrated a commitment to advancing nursing through research and scholarship. His areas of focus include nursing education, professional workforce development in nursing, and health promotion among older adults. Jason currently serves as a faculty liaison for the Dartmouth Centers for Health and Aging and served as chair of the ANCC Gerontological Nursing Board Certification Content Expert Panel. He serves in advisory roles on both the Forbes Education Advisory Board and the Forbes Medical Advisory Board. Jason assumed the role of Talent Director for Healthcare at inSpring in 2023. At inSpring, Dr. Garbarino's primary objective is to contribute to the growth, diversification, and global advancement of professional nursing practice. He resides in Vermont with his wife and 2 children. And that is a wonderful bio. I'm so excited again for this conversation. But the bio is only a little bit about you. So tell us a little bit more of you beyond the bio.
Yeah, again, thanks so much for the opportunity today. You know, in terms of being an educator for over a decade, I always liked to hear kind of how people entered the field of nursing. And my story began when I was in high school, when I was working on the volunteer fire department and going to emergency calls in my hometown. I started to become actively involved in collaborating with the ambulance crew and really started to lean into pursuing a career in the field of the medical career. Went and got my EMT. And through that process of working on the ambulance, I began taking patients regularly into the hospital. And that's where I became, aware of the wonderful career of nursing. A lot of people will have, family members or personal health stories that drew them to become nurses, but that's kind of how I entered the field. So did my undergraduate degree at the University of Vermont, where I ended up staying post graduation. I started working on the cardiology unit for about 4 years and then transitioned to the resource department at the University of Vermont Medical Center. I floated to about 17 different specialty areas. I think it really speaks to what I see as the best part of being a nurse, which is the versatility. I've always said if you're bored as a nurse, that's all on you. There's so many different career opportunities that you can follow. I really have complemented most of my career as a clinician, also as an educator. I love to teach. I really love to inspire the next generation of nurses. And in my role at inSpring, I wanted to be able to continue to actively work clinically and also teach. So, after being a full-time educator for over a decade, especially in my role as the program director, I became really involved in professional workforce development. There's a lot of press that you hear of the workforce shortage here in the United States for nursing, and the future looks really grim in terms of the 200,000 or so nurses we need by the end of the decade. And through that workforce development work, I grew a passion to play a more intentional role in trying to not only help to grow, but to diversify the professional nursing workforce. So in my current role, we work to establish pathways for international talent individuals who have interest in healthcare professions to come to the United States, pursue an accelerated nursing degree within 12 to 16 months, and then we help them transition to the professional nursing workforce here. And I've had a lot of rewarding positions in my 16-year nursing career, but this has been definitely one of the most fulfilling in terms of getting to assist individuals in pursuing their American dream. And sort of in collaboration with that, the vast majority, if not all of them, have this great sense of wanting to have some reciprocity, return to their home countries and advance global nursing abroad. So it's, through that, that I've become really impassioned to help our domestic talent and international talent get the rightful designation of nursing as a STEM profession.
I love that you mentioned, if you're bored, you need to figure yourself out in nursing. And I can totally appreciate that from a variety of different angles. Mainly because I've interacted with nurses just across the board in different capacities. And I think there is sort of a pop cultural reference that when you think of, oh, I'm a nurse, it's like, oh, you're just primary care. And there's so much beyond that.
Mm-hmm.
And there's so many different environments that you can work in. And then also, though, you can do part-time work as well in a variety of different environments. So can you talk a little bit about the versatility of those environments?
Absolutely. As we talked, I mentioned briefly the number of nurses that we need. I think ways that we can address that shortage also comes through some new approaches to how we utilize nurses and the opportunities available for them. The typical 3 12-hour shifts is a very hard work-life balance, especially if you're working night shifts. Some nurses are working 5 8-hour night shifts a week, and over time that can become unsustainable for a lot of reasons. So I think we need to start to think about out of the box ways that nurses can schedule their own schedules, maybe work a number of different jobs. I've seen a lot of new innovative ideas coming over the last couple of years, particularly after the pandemic. For example, I recently read an article about nursing sabbaticals, the nurses who are working in those critical care, ICU, high stress, high burnout jobs. Well, give them 2 or 3 months of working in less acute areas that are less stressful, allow them to recharge and reboot and, return to those areas that in many cases are their true passion. But there's such a high degree of continued stress and burnout that we need to think of ways outside of the traditional setting that nurses can work in.
That is awesome. I think that is spot on. You mentioned something around burnout. And when I think of burnout, I think of, clinician burnout, of medical doctor burnout, right? Which is a topic of concern. However, just as much of a topic of concern is the rest of the clinical staff and their level of burnout, in addition to the emotional turmoil. Because when you think about, the patient's perspective of their first point of contact, that usually for many people is a nurse. And so it's not just it's your medical team of who's taking care of you, but it's also your nursing team who is surrounding you, both from an emotional, spiritual, and obviously a physical point of view. Can you comment on that?
Absolutely. There's a lot of data out there, again, especially after post-pandemic. It really did turn the nursing profession on its head a little bit, at a time where we already were experiencing high projected numbers of, nurses retiring and leaving the profession, accompanied by our aging population, where we were able to predict that we were going to need more nurses. But post-pandemic, we were seeing statistics where up to 30% of our new graduate nurses were leaving the profession within 2 years. So, we have to look at ways to transform our educational models to give them the skills that they need to succeed in those areas. We need to make sure that we have good mentorship and support. We need to make sure that we're retaining nurses. I think that a lot of our younger graduates are looking for opportunities to travel, and I am all in support of nurses, taking advantage of that. But you need to have a foundation of your practice before you go ahead and do those things. And, I really want to see us get back to nurses having 2 or 3 years of solid foundational experience before they go and do these things, because I find that a lot of new grads are trying to take those on too early. And that's what leads to burnout, because they don't have that foundation. They haven't found their mentors that, teach them how to effectively manage the stress that's associated with the profession and the job at times.
Yeah, and you mentioned mentorship. And so what does mentorship in a nursing profession look like?
I have a number of mentors in my life for a number of different things. I mentioned when you shared my bio, I've gotten involved in research and evidence-based practice, and I have mentors for that. As I established my clinical, role as a nurse, I had mentors for that. As I've branched into leadership and education, I've had mentors for that. There's nothing I enjoy more than also providing some reciprocity in terms of mentorship. People think that you need to have certain skill sets to be a good mentor. But more than anything, it's just being a listening ear, an available individual, and, allowing people to talk out what they're thinking and sharing their next goals. In my time as an educator, I always tried to make it apparent that, when you graduate from UVM, I'm still there to serve as an advisee and a mentor. And I'm really grateful that I've had students who, over the last decade remain in contact with me. So anyone can be a mentor. A nursing student can be a mentor to, first and second year grads. It's really just allowing people to feel they have the support they need to continue to advance.
So we've talked a lot about burnout and employment, but I think that, and you talked anecdotally about your experience of how you were introduced to nursing, but I think for those who are interested, what are potential ways in which students could get a taste of nursing so that they can think about it as a potential career profession?
Great question. There's a lot of creative approaches to this. I'll use an example. In the state of Vermont, they have a young aspiring healthcare program that allows students over the summer to get to dabble and shadow a couple of different healthcare professions over the course of a week or so, and introduce them to the role of the nurse, but also a physical therapist, a physician, and allow them to kind of see what the various roles are. I think that's a really terrific model. As we kind of switch gears at some point today to talk about STEM and the Nursing is STEM Coalition, one of the main drivers of us doing this and looking for us to get proper designation for our profession is that there's hundreds of millions of dollars available for supporting STEM. And a big piece of that is creating opportunities through K through 12 education to have opportunities to get to explore STEM fields. So I think that adding nursing to that mix will be a great way to expose prospective future nurses to the profession.
Well, let's jump right into that then. I think, it's interesting because I like to think about it, I guess, quasi backwards, and the fact of, ask yourself, what does STEM mean to me? And then back into then, how does that portray itself into a career or develop into a career?
Mm-hmm. Mm-hmm. I think if there's any time to kind of support what we're looking to accomplish with the Nursing is STEM Coalition on, the tail end of this pandemic is the perfect time. You think back and it feels so long ago in some ways, but it also feels like it was just yesterday. We were seeing on the news the courageous nurses that were continuing to work during this global pandemic, right? And while doing this, I remember working as a nurse at this time. I was also running a nursing program of about 500 undergraduate students at the time. And it was literally, I would get an email of some sort of guidance. And an hour later, after I sent an email to faculty and students, we were getting, differing guidance of what to do to protect ourselves, to protect and provide the best patient care that we could. And a lot of that guidance and innovative thinking in ways to, combat this pandemic at the time were coming from the nurses who were working at the bedside, thinking of ways to use equipment in new ways that we didn't have available to help to ensure patient safety, using our science and technology skills, doing, firsthand in real-time engineering to try to, deal with a shortage of equipment that was really constantly happening at that time. So, we think of what nurses did during the pandemic, and I can't think of a better example to illustrate nursing within the STEM profession than that. With that in mind, there's been this long-standing push within the professional nursing workforce and education to try to encourage nursing to get appropriate designation from the various boards and foundations and departments that provide this designation. And unfortunately, it's something that hasn't been fully accomplished yet. There are some organizations, for example, the Department of Veterans Affairs sees nursing as a STEM profession. But with that lack of designation from some others, nursing has been left out of many opportunities. And I saw this when I was running a nursing program. For example, there's clubs on campus that nursing students weren't able to join because they weren't designated as a STEM field. As we built the coalition that I'll talk about, there were nursing faculty and leaders sharing stories of nursing students on campus who had to take required courses, but those STEM degrees were getting priority registration, and then their students weren't getting, spots to take the courses that were required of them. There are, huge dollars out there to provide scholarships to students, to provide scholarships and grant funding to education programs, to schools of nursing that, frankly, they've unfortunately been left out of.
Absolutely. I don't have any other words other than that. I totally agree with you. And it's so interesting to me to think about, as I think about STEM and I think about what I want the organization to be, I'm also thinking about introducing students to a variety of different careers, and what are the careers that align best with their sort of natural inherent gifts, right? And so if you think about problem solving skills or curiosity or sense of wonder and solving and being the good in the world that you want to see, those in particular are top of mind for nursing, because every single patient has an issue that you're presented with that needs to be remediated. You need to develop a strategy, and then you also need to deliver a treatment plan. Mm-hmm. That's all. I mean, in essence, it's a hypothesis-driven sort of piece. There's also the point of the curiosity, of understanding what is the medical malady at hand that you need to circumvent or treat, right? And so it's so when we initially had this conversation and we met for the first time, you introduced the concept of nursing as STEM, and I'm like, of course it is, because it's inherently gifted with all of those skills.
Mm-hmm. Mm-hmm. And that's kind of the across the board reaction when we kind of started out on this endeavor, and I can talk a little bit about that. Back in November of 2023, so we're really not talking long ago, we really saw, like many things in life, that something exists, but to enact the change, sometimes you just have to roll up your sleeves and volunteer to do it. So we as a small group saw the need to have this addressed, and we started to really target many of the boards and organizations that make these designations, but also kind of in conjunction to that, looking at the various professional nursing organizations that support nursing. For example, the American Nursing Association, the largest nursing association in the country, the AACN, which is the largest accrediting body of nursing programs, looking for their guidance in terms of what had been done in the past to try to get these appropriately designated. And we started to reach out to our connections, a lot of which on LinkedIn. It's I think nursing as a profession has been slow to adopt LinkedIn, but I think that's starting to change pretty drastically. And we started to make some organic posts about, hey, do people know that this is the case? And similar to you, the immediate gut reaction by the vast majority is, how is that not possible? How is nursing not already a STEM field? So through that process, we established the Nursing is STEM Coalition, which is a board of around 12 individuals who have the vast majority of which are nurses themselves. We tried to be intentional in selecting individuals who come from the clinical space, individuals who come from the education space, from the policy space and leadership space. We also have some other individuals on our board who have experience in international education and international practice. And also we have some interprofessional members, such as engineer who has a longstanding passion for supporting the field of nursing. And through that, we have built our first petition to a department which does designate fields as STEM or not STEM, which is the Department of Homeland Security. And over the course of just a few months, we had over 1,500 signatures to sign on to our petition, including all of the Ivy League nursing programs in the country. We have dozens of other nursing program leaders who have signed on, including international nursing programs. We have some of the largest healthcare organizations in the country who've signed on in their support. And then, as I mentioned, over 1,500 individual signatures. So speaks to going back to the idea of just having a group of individuals who are willing to make a movement and start it, and it kind of grows. Field of dreams, right? So what the Department of Homeland Security requires is that you have a formal petition which articulates how the profession meets the objectives of STEM fields, how nursing does indeed teach science, technology, engineering, and mathematics in their educational programs, and then how it also is applicable to the profession as a whole. So those are due in August of every year, and they're considered for redesignation. We should hopefully know within the next month or two if we get that designation. And what that means is that, as I mentioned, it'll open up a lot of funding opportunities for schools, for students, and that work. I think a really key piece of it is trying to get that early education exposure to the field of nursing that this funding will help with.
It's just shocking to me. I mean, I cannot, it's just, every single nurse that I've interacted with had to take a core curriculum of STEM classes, regardless of where they ended up in their career. So it's just again, shocking. I think the other piece to that is some of the most brilliant minds in clinical research were nurses that I have interacted with. And when I think about research, I only think about STEM, right? Especially clinical research. And so the ability to not recognize it is amazing to me and astounding to me. I'm curious about the Department of Homeland Security and why they're your target audience for right now, and what are the other potential future targets as well?
Great question. We went with the Department of Homeland Security because of the unlocked funding opportunities, but really the top reason is because of their deadline of August. We wanted to make sure that we were hitting that annual timeline. We just had a board meeting this week and talked about what is our next kind of goal. And one of the next likely petitions that we'll look at is towards the National Science Foundation, who does actually, considers nursing as a STEM field in some areas of NSF, but they have large grant dollars. I'm talking tens of millions of annual dollars that are for scholarships, STEM scholarships, but in their inclusion criteria, they include BS degrees, Bachelor in Science degrees, engineering degrees, but then there's a little caveat of exclusion for any sort of clinical degrees. So again, we're missing out on an opportunity for nurses, schools and professors, our nursing scientists that we have that are unfortunately currently excluded from that funding, and we hope to change that.
Thank you so much for mentioning that. My previous seasons of on this podcast have focused on graduate students who are currently in graduate programs, STEM programs, obviously, who have received the National Science Foundation Graduate Research Fellowship Awards. And I was one of them back in the day. I'm going to age myself 12 years ago. And I remember when I was applying for the award, and I went through a variety of different steps and stages, but what was reiterated to me multiple times was, do not say anything if you are speaking to the betterment of society that your research will be clinical. It has to be basic sciences. If you mention anything around humans or clinical or anything, it will be automatically disqualified. And for me, my fellowship was based off of single cell analysis. So it was cellular. But the obvious, and the reason that I went into healthcare, frankly, was because there is an automatic jump from single cell analysis to whole person care based off of personalized medicine. And so for me, it was really, really difficult to articulate the large scale impact of my study and my proposal without actually mentioning clinical care.
Mm-hmm. Mm-hmm. It is interesting. And I'm glad you brought up that example. There's actually someone, if you want to learn more about the Nursing is STEM Coalition, you can go to our website, nursingistem.org, but also, follow our LinkedIn page. And, there was a nurse who shared the story of knowing a nurse who received NSF funding. And once they found out they were a nurse, they took the funding back. So, it also makes me think of, fortunately, we don't live in a political time in our lives, right? Haha. It's so cool to be part of something right now that doesn't really have much opposition, but the one or two people who have shared some opposition here have felt that nursing receiving STEM designation takes away from the caring piece. And my response and thought to that is kind of exactly what you just explained. Our nursing scientists and engineers are another form of caring, right? You might be familiar with the acronym of STEAM, which adds A to the mix that, shares the arts. And I think that, by no means does nursing getting appropriate, proper STEM designation mean that it's any less caring. In fact, I sort of think there's the counter argument that those skill sets are an essential part of the care we provide.
So I'm going to probe at that a little bit. So what is the counter argument for nursing is STEM?
That's really the most in which I've heard is that there are those nurses who feel like the foundation of nursing lies in the art and caring, that they feel that nursing having that STEM designation in some way takes away from it. But in reality, nursing is both an art and a science.
Well, of course. I mean, we discussed that at the beginning of this podcast around, you have to take care of the whole person, the whole human. And that ranges from everything that can be seen to those that can be unseen, right?
Mm-hmm.
And that's, I mean, again, that's kind of the antithesis to your core curriculum, your educational basis, how you approach the patient in all of those different ways. So it's surprising to me.
Mhm.
Hmm.
But again,
Um,
that's, in a way, it's good that that's been what the counter argument to this has been. So I think it speaks to the overall consensus of this being something that's very long overdue.
no, absolutely, absolutely. Um, so as you think about sort of the next for inSpring in particular, I want to talk a little bit about that. What does the next 5 to 10 years look like for you? You've already talked about the organization and your sort of position there and your aims and goals. But future lookings, what's on your dream list for accomplishment?
um, Nursing has historically not been a diverse profession. If you look at the racial demographics of the profession, it has a much higher percentage of white workers than many other, fields, in addition to looking at just the general population racial demographics. There's a lot of data and research out there speaking to the need to have a diversified nursing workforce for the comfort of our patients that we serve. From a gender perspective, nursing has remained very sort of stagnant at about 90% female. Myself being, a white male, I'm very aware and conscious and open about acknowledging my privilege. But I also experienced a lot of discrimination when I was in nursing school. My first day of clinical on the postpartum unit, I had a nurse come up to me and tell me that they didn't want me there, that men didn't belong there. So, going back to the idea of mentorship, in my role as a faculty and as a nurse, I always tried to kind of mentor and support those, males that were joining the profession. So, why I've been so fortunate in my new role is I see it as an opportunity to bring additional diversity to the profession. It's one of those things, similar to the STEM coalition. I felt like I wanted to play a more intentional role in rolling up my sleeves, and to try to tackle this head on.
You hit on something that was really astounding to me. Um, so, as being a white female in essentially an engineering program, I can not only appreciate but can double down on the fact of being a minority is really challenging in a variety of different ways. I think saying there, oh, you don't need you shouldn't be there is on par with being pat on the head and saying you're cute.
Right.
Um,
Right.
that happened to me, and it evokes a sense of questioning whether that career is an optimal career for you or a job is an optimal job for you.
Mm,
And yet, if that's where your passion lies, you should learn from it and you should maximize it and really take that and leverage it.
mhm, mhm. 100%. I think of, unfortunately, there were a lot of, male nursing students who left in my time as an educator. I think of the male students who told me that they would not be seen walking across campus in their scrubs because they felt they'd be ridiculed. When, inverse to that, since before 9/11, the last year that nurses weren't seen, according to the polls, as the most trusted profession in the United States. When 9/11 occurred, the firefighters rightfully took that honor that year. But, to have this sort of public perception of it being the most honored and trusted profession, but also having a tremendous amount of stigma behind it. I also had my guard up every clinical rotation that I had for the young female students who were daily harassed by patients by doing things similar to what you just said, in terms of being cute or sexy or wanting them to hop into bed with them, all these sort of horrendous things that, nursing students unfortunately have been exposed to.
Yeah, and that I think we circle back to that conversation around, the causes and causation of burnout is not just because of the job stress, but the job stress not only for the work that is required of you, but the extra work that is not required of you that you have to do in order to be to combat.
Yeah,
It's
yeah,
like combat pay, for lack of a better word.
for sure. Yeah, absolutely.
So, Jason, given that, and given our time is wrapping up, I do want to ask you, if you were to think back 10, 15 years ago, what words of wisdom would you impart to yourself um, as a student? And, and what would you say to the next generation of nurses?
Such a good question, and one I'd probably have to think at to give a more articulate answer. But, besides marrying my wife, I always say that the best decision I've ever made was to become a nurse. I couldn't, if I were to go back 15 years ago, I would have been a nurse again. It's allowed me to travel the world. As a researcher, an educator. I've done global disaster relief work as a nurse. If you're looking for a career in which you can travel, there's tremendous opportunities to travel as a nurse. In comparison to a field like medicine where you specialize in a certain area, and it's hard to kind of transition. I've worked in so many different areas: inpatient, outpatient, education, research. There's no end to the things that you can do as a nurse, and I feel like I've just scratched the surface in terms of what's out there as potential work opportunities.
I love that. And thank you for juxtaposing, I think, to medical clinicians, doctors. I think that's spot on. The versatility is there.
Mhm.
And with that, I thank you, Jason, for your time. This has been a wonderful conversation. And I really hope that people get to be on your bandwagon of creating nursing is STEM. I mean, it's kind of obvious.
Thank you. And on that note, we're still continuing to collect signatures. We're looking for individual signatures. We're looking for organizations to sign on. And I just want to point out too, it's not just nurses. If you love a nurse, if you know a nurse, sign the petition. We've gotten really explicit feedback from these departments and foundations that having a strong, robust group of individuals and signatures is really key to our success. So we appreciate everyone taking the time to check out the coalition and support what we're doing. And I want to thank you for allowing me to join your podcast and a great conversation.
Yeah, of course. No, of course. And if you want to find more information, please follow us on our podcast as well as our website, which we will link out to Jason's. So thank you again, Jason. And it's been such a pleasure. Bye,
All right.
everyone.
Take care.
At STEM From, we are working towards making all STEM careers achievable, regardless of your identity, background, or even access to resources. Here at STEM From, we will introduce you to all things STEM, whether they be careers, research, tips and tricks, and even inspiration. Thanks all for watching and learning with us today. And don't forget to ask yourselves, where do you want your journey to stem from? Thanks, everyone. Bye.